already.
Hi, I'm Nancy Thompson, the Functional Fitness Specialist at the Springfield Wellness Center. I want to let you know about hip mobility today. I work with a lot of patients and clients here that there's a wide range. We have patients who are very inactive adults who sit at a desk all day and then they retreat to the recliner at home at night. I have patients on the other end of the spectrum, the high intensity exerciser, crossfitter, bodybuilder who probably does too much and is hurting themselves or having some chronic issues with often their hips. And so they have this thing in common. They have very, very inflexible or stiff hips. So surprisingly, these two very different patients need often the same type of treatment or mobility and stability exercises for their core to help maybe stabilize their hips and reduce the inflexibility of their hips. So these exercises I'm going to show you today are the foundational exercises for good core stability. They're going to hopefully bring about better stability of the core and pelvis that will lead to less muscles that are being overused in the hips or becoming tight from too much sitting. And we're going to do the exercises that are also going to take you through an active range of motion for the hip, again bringing about better hip mobility. So the first one is, well, they're all going to be done on the floor, so we're going to be able to isolate those muscles. The first one is a reverse crunch. Everybody that we see in here goes through these 4 foundational exercises. The reverse crunch is where we want to start by, I have most people lift their head and shoulders to help brace the core and the spine. And then we add leg movement by pulling knees in and then inhaling and lowering heels down to activate the lower core muscles. This can be regressed by having the head laid back if that hurts or is difficult for somebody with neck issues to hold up. But again, we want to make sure they're bracing the core and bringing the knees in. We can even do one leg at a time if necessary, if low back is an issue for some people. And then we can even add legs longer to progress the exercise. So there's things we can do to make it more challenging, but it's going to help strengthen the lower core muscles. The second one's going to work the opposite side, the shoulder bridge. We'll want to let the head relax, the shoulders stay down, the feet stay down, hips width apart. And then we have a pelvic tilt. We have our patients think again about stabilizing the core, pulling the belly button down, then lifting the hips up into the bridge to engage the glutes and the hamstrings. And that's going to help again balance out the stability of the lower core. So we'll want to do shoulder bridges as well. The next one we do while we have people reclined, we want to have people's arms out in a cross position. We start with the feet on the floor, and to strengthen the oblique muscles, we do recline twists, lowering the knees, not just letting them fall and twisting with momentum, but we lower, and then we lift the legs back to center, and we lower and lift. And again, as we progress people through, we bring feet off the floor, and we can bring the feet even farther away from the bottom to make them move more challenging, to strengthen the obliques in the center part of the core for that portion of our core stability. And then to take the hip through its active range of motion, we'll get people in an all-fours position, making sure that they pull the belly button up to avoid any sagging through the lower back to support that lumbar area. And then we start just by a simple fire hydrant move, lifting the leg up and lowering it down. Again, we always want to lift and lower, we don't throw and drop. And then we progress people into a full range of motion, and a lot of people can start right off with this and really work all the muscles, moving them as well as strengthening them through the whole active range of motion, doing both directions. And those are the 4 basic exercises. To keep it balanced, I always suggest people stay balanced in the number of reps and sets they do. So we usually have people do 2 sets for time reasons, 2 sets of anywhere from 15 to 25 here in the Functional Fitness Center, but at home you can even do more reps or add a 3rd set to really start gaining strength and then mobility in the hip joint, and hopefully improve your hip mobility and reduce strain on your hip and then probably your lower back. So those are some nice tips and foundational moves to improve hip mobility. If you found this information helpful, please share it with your friends. This is Nancy Thompson, your Functional Fitness Specialist at the Springfield Wellness Center.